My name is Biodun Ogungbo, consultant neurosurgeon. I'm going to talk to us today about spinal cord injuries. The International Spinal Cord Society recently sent information out about marking the Spinal Cord Injury Day. This day has always been marked on the 5th of September, and it comes up on Tuesday, 5th of September this year. This is important because what we want to do is to improve the lives of people who have suffered spinal cord injury. One of the key things is to do strong advocacy to highlight the obstacles in their lives in order that we can help make their lives better. So this presentation will be talking about making the lives of people who have suffered a spinal cord injury better and what you and I can do to actually improve the situation. The theme for this year's celebration, in a way, is Yes, we can. We can manage spinal cord injury. We can do that effectively in Nigeria, and we can improve the lives of people who have suffered spinal cord injury in sincerity by working together. So this presentation is from the Brain and Spine Surgery Consortium in Abuja, but we are working with other organizations and hospitals to improve the lives of patients who have suffered spinal cord injury. I'll give you an example. We recently, this year, recorded our 50th operation, and we managed a patient with spinal cord injury. So this patient, a 65-year-old gentleman, suffered a road traffic accident and severe spinal cord injury. Initially, it was being managed in one of our public hospitals. But because the hospital doesn't have the facility to look after him, we were invited to take over his care. Before we actually got involved, he had already developed lots of complications from being bedridden. So we had to move to transfer him, offer surgical intervention, and manage this case successfully. I'll take you through the actual case. These x-rays, and they have been annotated in color to show exactly how bad things were. The x-rays show the injury and the dislocation of the neck. You can see that one of the bones has shifted in front of the other, and they're no longer in alignment. Because of this, the spinal cord inside the bone is injured, and we can see that on this MRI scan. At the operation, we actually had to remove the shock absorber, which is the disc between the bones that shifted, and that's the object that you see on the right-hand side. This is us in theater getting ready for the operation. Once we've done the operation, this is what it looks like. Now we have realigned the neck and put the bones back together into alignment. The arrows point to the way the neck should be, and the area that's been broken is now held together by what we call plates and screws, which is what you see here. So the issue with patients with spinal cord injury is that right from the time of the accident, they need to be managed properly. We need the police, we need the first responders, we need NEMA, we need all those agencies who are involved in retrieving people in road traffic accidents to be aware that the person involved in the accident may have suffered a spinal cord injury. If that's the case, then they need to manage them, look after them, move them very, very carefully. So all this kind of initial response must be geared towards not making the injury worse than what it is. We have seen a lot of patients who have been involved in a road traffic accident and they're still able to move their arms and legs, but after they've been pulled out of the vehicles, they become completely and sometimes permanently paralyzed. So right from the time of the accident, extreme care must be taken not to make a mild situation worse. Patients who are then transported to a hospital should be managed appropriately. If the hospital does not have the facility, nor the skill, expertise, or the equipment to manage patients with spinal cord injuries, then please refer them as soon as possible to another facility where the appropriate care can be undertaken. If this is not done, then patients can die, patients can become permanently disabled, or they can have other complications which they didn't come into hospital with. So the advocacy and what we're talking about as we move towards the 5th of September is that we need to reduce the obstacles and improve the lives of patients with spinal cord injury. Join us. The theme for this year is Yes, We Can. We can manage patients with spinal cord injury, and we can improve the quality of their lives. This presentation is from the Brain and Spine Surgery Consortium. You can call us on 08122221616 or find us on Facebook.